With COVID-19 resurging globally, China has also felt the impact. Between March the 1st and March the 18th, over 29,000 new cases were reported, and also the first two pandemic-related deaths in over a year. While the health authorities say more than 95% of the cases are mild or asymptomatic, prevention and control remains the priority. What's being done to control the new surge, and what are the fresh challenges for China's dynamic zero-COVID policy? I'm pleased to be joined from Nanjing in southern China by Professor Wu Zhiwei from the Center for Public Health Research of the Medical School at Nanjing University, and by Dr. Eric Ding, epidemiologist and chief of COVID task force of the World Health Network, joining us from DC. Gentlemen, long time no see. It's good to have you back on the show. Professor Wu, let me go to you first. I think it is necessary to provide the context of this latest pandemic surge, because not everybody is up to date with what has happened to China so far. As I understand, up to now, since the very beginning of the pandemic outbreak in early 2020, 4,638 deaths have been reported. Last week, 2 deaths were reported. Those were the first pandemic-related deaths since January 25th, 2021, when the last death in China was reported, and there were just 2 deaths in the whole year of 2021. Basically throughout last year. And over the last week, however, the number has been climbing. China has reported more than 2,000 local new cases daily on average. So, Professor Wu, help us understand the situation. What's causing the latest surge, and how serious is it?
Well, first, this time the virus is Omicron, and also an Omicron's variant, which is called BA2. Both are highly infectious and transmitted very quickly. I think that's the basic virological features in a new surge. The other thing is that if you look at the various different localities, there are a lot more asymptomatic infections as well. So that's why when you find in the positive case usually has been circulating unnoticed for quite a while. So when you expand the nucleic acid test, you quickly find more and more people getting infected. But then overall, as you just mentioned, that the severe cases, the rates are very low. If you look at the so far the accumulated infected cases, more than 20,000 cases, actually only 39 severe cases, and 2 cases were attributed to the deaths attributed to the COVID-19. So proportionally, it's extremely low. Overall, that's the overall situation in the country right now.
Dr. Ding, both of the 2 reported death cases were senior people aged over 60 with severe underlying diseases, and one of them was not vaccinated. Head of the Bureau of Medical Administration of the National Health Commission said, adding that their underlying diseases were the direct cause of their deaths, as they were mild COVID-19 cases. What do you think such facts or such information is indicating about the nature of the outbreak this time?
Yeah, thanks for having me. BA2 is very contagious. I want to point out that BA2 is very different from the old BA1 Omicron. They are more different from each other than the Delta variant is from the Wuhan strain. And I want to really emphasize it should be its own variant. And, these deaths, you can say it's milder than Delta, by the way. Delta is a much more severe strain, but it doesn't make it more milder than Wuhan per se. And again, the reason it's causing this huge excess deaths in many countries around the world that had BA2 or have BA2 surging is that when you increase the total number of cases, there will inevitably be more hospitalizations and deaths. So you could, right now with 2 cases, it's hard to attribute directly, but we are seeing excess deaths. Hong Kong is seeing extremely high excess deaths. And the truth is, in China, of those over the age of 80, less than half are fully vaccinated. And being fully vaccinated is not enough. Fully vaccinated with 2 shots is only about 75% hospitalization protection. Only with 3 shots, boosters, for example, with Pfizer, you have 95% protection. But so we're not quite sure if the boosters with Sinopharm and Sinovac are as high efficacy. And there's clearly not enough people who are vaccinated in mainland China. So we shouldn't right now just say, oh, we only have 2 deaths. If we let the cases get out of control, runaway cases is what will endanger China, just like it endangered Hong Kong and the world. So we must be vigilant with this vigilance of lockdowns and testing and quarantine isolation.
Basically, that's what the Chinese authorities have been doing. They are not changing their dynamic zero COVID strategy, which means whenever there is a case, they will try to suppress it as fast, as much as they can, so that it comes always close to zero, so that it doesn't erupt. But Professor Wu, do you see the Chinese government still pursuing this policy despite the lower percentage of severe cases and possibly the lower percentage of deaths as a result of this virus?
Well, I see a very small shift in terms of dynamic zero tolerance policy. If you look at the current situation across the country in various different jurisdictions, you don't see the entire city being locked down. Usually you will see much smaller communities. And also in some areas, part of our cities will be locked down. So which makes it very different from the earlier policy. I think this is very much in the background that we see a lot of lower rates of hospitalization and death. And the other thing is that in China, if you look at the overall completed vaccination rates in the country is close to 90%. In the elderly population, people who are over 60 years old, the vaccination rates right now stands at 81%. So there is a certain space that we could push further to vaccinate the elderly people, which is at a higher risk in terms of contracting the COVID-19. So I think as we increase in vaccination rates, and we could shift or adjust a certain policy in terms of control. I would call it so-called stepwise dynamic zero tolerance, which actually would give the minimal disruption in the daily life and the economic activities.
Dr. Ding, how do you look at the possible way out where China can meet the goal of protecting people's lives, of course, but also keeping the minimum impact on social and economic life, and also gradually open international travel?
That's a very good question. Right now, the issue is there's not enough elderly vaccinated over age 80. As again, it's only about 50% with 2 shots, and clearly not enough with boosters. Boosters are what you need against Omicron or BA2. You absolutely need them, and China does not have enough of them. And I think the other key thing is that boosters, while they protect you against hospitalizations and severe disease, this transmission, it's like if you have a 4-lane highway, you close 2 lanes of the highway, you're still allowing a lot of virus to spread, even if it's asymptomatic. And these vaccines are not stopping BA2 asymptomatic enough. It's only slowing it down by closing part of the highway. And so this is where we need this multiple layers of mitigation. We need N95 masks, not just surgical masks that we see a lot of times. We need indoor ventilation, air disinfection, not spraying surfaces or wiping us, but air disinfection. And of course, we need testing and isolation. If you have all those, then you can perhaps keep things open. But if you don't have all 3 or 4 of them, you have to then use lockdown as the last resort. And right now, China is in a really bad wave, and you have to keep things in control. And that's why Disneyland Shanghai closed recently, as they just announced today. So we have to keep mitigating until you have all these other barriers in place, and when you can safely reopen.
Right. Well, people certainly have maybe had a sense of complacency because over the past 2 years, more than 2 years, they have been relatively safe and they're kind of used to living with the virus, although now it's kind of a wake-up call. I have to point out that over 3 billion shots of vaccines have been administered in China. So for a country of 1.4 billion, or everything for free, of course, for a country of 1.4 billion, that's already a great thing, quite a remarkable achievement. But very briefly, Professor Wu, do you see that China still has a chance in the race against time to keep the virus under control, but still having to meet the world, somewhere halfway?
I would think so. I'm quite optimistic that China has done two very important things right now. One is that the country is expanding the nucleic acid test very rapidly. Basically, they set up a different testing posts to trying to shorten the time for getting all the results, which is very critical for earlier intervention of this Omicron. The other thing is that China just authorized the Pfizer's therapeutic drug Paxlovid, which is very important because once you are getting sick, then you could get a treatment in the hospital. So those are so-called building multiple intervention approach. It would be very critical for dealing with the virus.
We'll keep a close watch on the situation and we'll bring you the update. Many thanks, Professor Wu Zhiwei and Eric Ding. As always, great to have you on the show. And with that, we come to the end of this edition of The Point with me, Liu Xin. As always, you can follow me on Facebook and Twitter using the handle Liu Xin in Beijing. Download the application called CGTN to watch the show on your mobile devices, or go to YouTube and look for CGTN The Point. Thanks for watching. You've got The Point.